My name is Shane Higgins and I'm the Master of the National Maternity Hospital. Due to the COVID-19 pandemic, we've had to make amendments to our policies with regards to patient visiting and patients attending for clinic visits. We've also made some significant infrastructural changes to the hospital over the last 2 to 3 weeks to allow us to cater for all patients attending the hospital and ensure that all patients are cared for in a safe manner. If you have a scheduled appointment at the hospital, we ask you that you attend for this appointment on your own. If you're an inpatient or somebody who's had a baby in the hospital, we ask that no visitors visit you during your time in the hospital. If you have a baby in the neonatal nursery, we ask that only mothers attend to their babies during this time. If you fall into one of the following 3 categories of patients, we ask you that you follow the following policy. If you have been diagnosed as having the condition, if you have signs or symptoms of the condition, or if you've been in close contact with a relative who may have the condition, we ask that you undertake the following procedures. We ask firstly that you phone the hospital in advance of attending. When you do arrive at the front door of the hospital, we ask that you phone again the following number to ensure that the most appropriate member of staff in personal protective equipment is there to meet you. This will allow them to guide you in the most expeditious fashion to the most appropriate area of the hospital for you to be continuing to be cared for. We ask that you don't take public transport to the hospital if you feel you may have the condition. Over the past couple of weeks, we have created a hospital within a hospital. This area behind me has been converted into a negative pressure ventilated area, our isolation ward, which will allow us to look after patients who have a suspected or confirmed diagnosis of COVID-19 infection. We have an operating theatre and 16 beds, which are all negative pressure ventilated. This allows us to have the remainder of the hospital functioning normally. The purpose of the policy changes and the infrastructural changes that we've made is to allow us to look after all patients with a suspected or confirmed diagnosis safely, whilst allowing hospital staff and non-infected patients to continue to have their babies in the safest possible manner. These policies may change over the coming weeks with the best available evidence. When we do so, we will update our information to patients and staff, but we will continue to look after you in the safest possible manner. I wish to assure you that the heart of the National Maternity Hospital is still beating strongly. Over the last number of weeks, we have prepared the hospital and staff to look after all patients attending the hospital, whether they have a COVID-19 infection diagnosis or not. Thank you.